Hi, my name is Shania Marler, and today I'll be presenting an informative speech on Ebola. According to the CDC website, Ebola is known as a fever, is a rare disease and deadly disease caused by infection with one of the Ebola virus strains. Ebola can cause disease in human and non-human primates. Some non-human primates include monkeys, gorillas, and chimpanzees. Many have been asking what causes Ebola and what are the symptoms and how is it treated. Caused by infection with a virus in the virus family, 5 identified Ebola viruses species, 4 in which are known to cause disease in humans. Some symptoms of Ebola include nausea and vomiting, diarrhea, may be bloody, red eyes, raised rash, chest pain and cough, stomach pain, severe weight loss, bleeding usually from the eyes, and bruising. Some treatment might include balancing electrolytes, maintaining oxygen status, treating other infections if they occur, and monitoring the patient for other specific signs. Note, these will not cure Ebola, but only increase the chance of survival. Ebola is not spread through casual contact, air, water, or food-grown products within the U.S. Ebola can spread through direct contact of bodily fluids with someone who has been contaminated with the Ebola virus. Objects that have been contaminated with the virus, needles or medical equipment, infected animals by contact with the blood or fluids, or infected meat. Symptoms can appear as early as 2 days to even 21 days. After 21 days, if there is no symptoms of Ebola, there will not be any later, and the subject will not be infected. Still, the chances you'll be exposed to Ebola in the United States are very low because of the tight infection control practices of public health workers here. 10 essential facts about Ebola. The current Ebola outbreak is most widespread and intense in West Africa. The country of Guinea, Sierra, Liberia have reported the most infections, with additional 20 cases in Nigeria. People who are most at risk are those who work close with the infected patient. The second most essential fact is travel warnings have been issued for Guinea, Liberia, and Sierra Leone. 3. Main entry points to the United States from West Africa have been screened for Ebola causes. 4. Ebola is caused by an RNA virus. This emerging health threat is a result of the RNA ribonucleic nucleic acid virus that infects wild animals like fruit bats, monkeys, or gorillas, and chimpanzees. Early Ebola symptoms are also symptoms of other viral infections. Bleeding is common in the later stages of Ebola. Ebola is often fatal. Of the 24,280 cases in the current outbreak, 9,976 deaths were reported as of March 11th, according to WHO statistics. 8 new Ebola medications are in development. The U.S. Drug and Food Administration has not yet approved any treatments for Ebola. 9. There is no vaccine to prevent Ebola. Vaccines in development have been effective at preventing Ebola infections in animal studies. Lastly, Ebola is not at risk to general public in the United States. You are not at risk for Ebola infections unless you have direct contact with blood or other bodily fluids of someone who has been in contact with Ebola. To protect the U.S., the CDC is building up their capacity for testing and surveillance to avoid Ebola being spread, and other infectious control information has been released to keep healthcare workers out of risk for contracting Ebola. And this concludes my speech about Ebola. Thank you for watching.